Now, the coalition of CSOs in HIV, AIDS, tuberculosis and malaria is asking government to ensure the remaining containers of drugs at the harbour are cleared. The request follows the clearing of 14 out of 182 containers of locked-up pharmaceutical products by the Ghana Revenue Authority to the Ministry of Health. The drugs are needed in the fight against HIV, AIDS, malaria and tuberculosis. Leader of the coalition, Ernest Otin, joins me for a conversation. Ernest, I'm grateful for your time. It must be heartwarming, first of all, to know that at least 14 of the containers have been cleared.
Yes, thank you very much, and thank you for the opportunity. Last Friday, we were quite excited to see the 14 containers cleared. We saw it as a symbolic gesture to actually spend the fact that where the Commissioner General of the started and the process began. Spoke with her after 14 weeks and she started sure this very week the remaining containers will be cleared.
And how urgent is it for the remaining containers to be cleared?
It is very, very urgent. If we start with the malaria commodities, for example, you know, the rains are upon us now. The rainy season is just starting. And around this time, we see increases in cases of malaria because of stagnant waters, breeding of mosquitoes, and all of that. So this is the time normally distribute beds to pregnant men and children under 5. So urgently need the bed to come out. For us, our information is that starting from next week, we are likely to witness a very serious knockout, the commodity. So we will get into the health activities between now and of the month. For this, it is a thing. We are not running out medicine for TB. So we really need to have this and take it seriously.
Now, let's look at, the situation generally. If we talk about HIV, AIDS, you just spoke about malaria. You look at tuberculosis. Paint a picture of what the situation is right now.
Well, we have been saying for HIV, we are receiving reports from some health facilities that the adult patients have gone up. And so what is that the pediatric medications for children, those are the that given to adults. Had one of these reports coming from Texas. So I'll try to find out from them if this is correct or not. Some of our members have been to some health facilities and they have not gotten their food flight. Normally, when a client very simple on treatment, they are given 6 months or 3 months supply of medication. But we have a situation where some are getting just 1 month supply because of the non-availability of the drug. For AF, for TB is the same scenario, and then for malaria, we need the bed because they really in this offer.
How then do you intend to get government, push government to actually heed to your demand?
Yes, tomorrow we are going to have a meeting with the acting Commissioner General of the GRA. She was the one who gave us assurance from the beginning that within a maximum of 14 days, she would ensure that all the communities will be cleared. And we are very grateful that within the very first week, we had those 14 cleared. Like I said, we saw it as a symbolic gesture, and she actually married her way. So we are going to stay tomorrow to have a roadmap that will ensure that all the commodities will be.
I'm grateful for your time. Ernest Otin is president of the Ghana HIV and AIDS Network.